Hi, I'm Morgan Galetta, and I'm going to be checking off Ruben on chest and lungs.
I, Jacob Clark, hereby give my written and verbal consent to be filmed in the Liberty University Nursing Exam Suites in the Nursing Department at Liberty University as part of the Nursing 210 Adult Health Assessment / Nursing 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission for the film containing my image to be submitted to a secured YouTube site viewable by the nursing student and the instructor of the course. I understand that during the examination and filming, areas of my body will be uncovered, exposed, inspected, palpated, percussed, and osculated by the student nurse. With this understanding, I give my consent.
Hi, my name is RubenCarlo, student nurse here, and your date of birth?
11/7/94.
Awesome. So I'm going to assess your chest and lungs. Just to begin with inspection, I can see that the skin on the chest is consistent with the rest of the body. I see no signs of arrhythmia or venous patterns. There is even hair distribution consistent with male patterns. I can also see that on the lips there is no signs of cyanosis, neither any coloring on the upper extremities, which is a good indication of circulation in the body. I can also tell that there is a very minor pulsation just right below on your right side of the C7, the costal rib 7, and you do have a secondary lesion just right below that on the other side, on your left side, and it also goes over to your lateral side, almost to your covering your posterior left side, and this is due to
A diaphragmatic hernia.
Okay, and you did have surgery for that, correct?
Correct, this past June and at birth.
Awesome. Okay. I can also see upon inspection that there are no signs of kyphosis, lordosis, or scoliosis. Um, the trachea did look midline and was consistent in the midline. I can just to point out some anatomical areas, the suprasternal notch. We did mention the costal 7 ribs, and just right here is the angle of Louis. To begin with pulsation, every time I put my hand on your back, just go ahead and verbalize 99. You ready?
99, 99, 99, 99.
Awesome. So tactile feminist did show bilateral symmetry. And if you could, I'm going to ask you if you can stand straight, and just go ahead and take a deep breath and then exhale. Okay, so this showing thoracic expansion was symmetrical. And if you can also lean forward with your arms crossed. Okay, so what I'm going to ask you to do is to take a deep breath and then hold it, and I'm going to palpate you. Okay, so go ahead. Okay, hold it. Okay. You can go ahead and exhale. All right. And I'm gonna ask you to do the same thing. This time you're gonna take a deep breath, exhale, and hold that. So go ahead. Okay. Gonna breathe. We'll take that measurement real quick. So, just upon measurement, it is 5 centimeters, which is a normal limits for diaphragmatic expulsion. And this shows the movement of the diaphragm up and down the body as he respirates. I'm just going to palpate you right now, so you can go ahead and breathe normal. Okay. And just gonna switch to the front. You can sit up straight real quick. Alright, and if you could just stick your hands up on your head. Okay. Okay. I did notice some sounds lower in this near the costal 7, and that's probably just because he did. Did you just eat recently?
I
or-
just had breakfast.
Okay, so I did hear some sounds, which is normal. There wasn't any abnormal adventitious sounds. But it was bilateral, although upon auscultation, I didn't note any wheezing, no stridor, nothing abnormal. And I just to add, I can say that my patient is healthy even after the diaphragmatic surgery, and I guess that's it.